talk about data quality, we're talking about the outcomes data quality, the data that's being entered into the Cerner EHR system. So we have doctors, we have nurses and therapists entering in, various measures that are related to data the hospital is taking. So, for example, a nurse might record the temperature of a patient in relative time, and we want to know if that entry is valid. So a nurse could be entering 180 degrees is the temperature. We know that's not possible. Like, that's not suitable for life. So we want to be detecting that as far as a data quality perspective goes, in order to monitor those types of measures. And also the goal with that is that the hospital is putting out some very good, very cool predictive, groundbreaking predictive technologies and models, and we want to have a way to monitor the data quality, monitor the health of the data to validate those models and say there's some good data going in, and so monitoring data quality becomes important from that perspective as well. So in order to do this, the chief medical officer engaged us to find a way to monitor a majority of the information that the hospital is taking in for data entry quality and other types of issues that could potentially happen with data. So we look at the scenario over here that was happening is there's, like I mentioned, a lot of predictive modeling efforts, and we just wanted to find a way to have some clear and cut ways to define the quality of the data and monitor that. We also found that although that data quality issues could be detected on the back end, so someone could say, oh, this isn't a valid value, I want to not use it. There was kind of a lack of accountability for how that value arrives. So we wanted a tool that would allow for some root cause analysis on potentially why certain aspects of the data being captured were not being captured correctly, and understand the volume for that to be able to really get down to some continuous improvement and potential re-education. And so, we see this as not only a tool that can help you just understand the data, but also help improve the way that the clinicians and therapists do their job by monitoring how how these tests are conducted and how the data is captured. So in order to accomplish this, we had to truly understand some of the data that was being captured at the hospital. So we monitor for around a high amount of fields, so 1,300 fields across 53 different therapeutic assessments. And so we had to interview therapists, nurses, and clinicians to obtain the acceptable thresholds for those data fields, as well as find out a way to display those in a way that would take data quality, which maybe at times isn't the most exciting thing in the world, and turn it into a really interactive, highly visual display that allows for people to make real interpretations of how data is being captured at the hospital. So in order to do that, we developed a data exploration and a data quality report. And so as we move into the demonstration, I want to highlight how those two views can be used to help, first of all, understand the overall data quality and associated trends. So if data quality is improving or not improving, you want to be able to track that, as well as understand if any intervention methods are improving the data quality. Also have the ability to look at the quality of individual therapeutic measures. So this really allows for root causing of where potential data entry errors are occurring. And then also have the ability to view the distributions of certain measures. So it might be very helpful for someone to say, okay, hey, I have this field that has some data quality issues. I want to see how the data for this field is distributed, and is it a normal distribution? What's the ranges? What are the averages? And so forth. So going to move into the tools that we created and start with the discrepancy report. That's what we call the data quality report that we generated. And once again, this would be displayed on the portal that we created. and be very easy to see for the users that need to get these views, you know, at maybe a monthly or weekly basis. And then, as always, this is once again dummy data, so doesn't mean much in the context of the hospital outside of the ideas. So here's the exact page that someone would see who is using the portal. Right away, you can see the rate of values that are being entered that are considered invalid, meaning they are, you know, data entry errors. We can track the trend over time. So here's a 12-month trailing, and you can see that in this version of the data that we've pulled here, that the rate is actually increasing. So that might be a good thing to know and note. We also provide a way to be able to see, you know, start to get at why the quality of the data might be increasing. What is the area where the quality is not necessarily there. And so then we also have the ability to look into all of the various assessments. So you can kind of view an assessment as a form that an individual at the hospital uses to collect data on a patient. So I think we have around 50 or 53 forms that we're tracking across these 5 different disciplines. And so it's quite a few measures that we're trying to keep track of. And then one thing that we might want to do here is look at a specific assessment or a specific form to monitor if the individual fields on that form have data quality issues, and try to further boil down what's occurring and what's happening with the data being captured. And so this is where you can really start to understand how certain people are executing these therapeutic tests or entering the data. And we understand that you know, a lot of the job of sometimes these doctors and nurses is data entry, but it might not be something that, you know, they're necessarily keeping top of mind, because there's a lot of, you know, obviously there's a lot of other aspects that are going into their job. So you know, we really want to monitor the fact that there's all these different pieces of information, and trying to understand, you know, for example, if there is a case where maybe temperature is being taken incorrectly and the data is being fat thumbed for some reason, you'd want to know, first of all, that's happening and why that's happening. So we display the items on the forms and their relative error rates, as well as you know, which forms are actually attributing to those particular data entry errors. So it's a good comprehensive look at not only the global scope, but also the individual assessment and form level, and understanding what's going on with the data quality in that respect. And then, you know, lastly, I mentioned that we also have the ability to look at the distribution of the data. So I can click over here and find out a little bit more about what this assessment is. I think that, you know, if you're taking a look at the quality, it's really valuable to also understand the data in general that you're looking at. And so things you might want to know is how frequently this form is being filled out, what the patient's distribution is for that, as well as how the distributions of the various items look. So the tool that we created, we can look directly into what the distributions look like. And so this is all the data being plotted. I can really easily see the ranges. And so we can have conversations about, is that an acceptable range or not? And you see this distribution. And one interesting thing is we see maybe there's this double distribution over here, can detect if there's a different change if they're measured in different ways. So some really interesting insights that you can gather from this tool. So wrapping up the data quality tools that we have here, you know, it's really a great way to understand the monitor and monitor the health of the data. And so, for example, we have, you know, the predictive models. They understand that, you know, there's outliers and everything, but if we can do a little bit of work up front and understand what those outliers are coming from, if they're data entry errors or if they're actually true outliers, it helps, you know, not only alleviate some of the work that has to be done on the back end, but get a sense of how quality the data is going into the front end, and holding those people accountable for when the data is bad, and trying to figure out exactly the reason why. And so now what can be done is users who are operating this tool can monitor pretty much every single 13 of the 1,300 fields that are being used to capture information on patients at the hospital. We can understand, if the trend is increasing or decreasing. Some really easy to use and easy to gather insights that are available very quickly.